Hello, my name is Thea Newman and I am the director of Solar Avis. In this short presentation, I want to take you on a journey looking at mortality figures in Scotland in 2021. I'll show you that there are some trends in the data which are concerning and which are not directly related to deaths from COVID per se. This video is aimed primarily at stakeholders in Scotland, the primary stakeholder of course being the Scottish people. As such, I will aim to avoid using technical language so that everyone who wishes to understand this video will be able to follow along. I hope this presentation is also useful to officials in the Scottish Government and the health services. If you are watching this presentation from another country, it may be that the analysis I show you is something that you could do for your country's mortality data. It would be very interesting to compare, so please do let me know if you do such an analysis. Maybe we can learn from one another. I will now turn to some slides to show you the data and the analysis, and I will be back in person to summarize that part of the presentation. After that, things will be a little bit more speculative as I try to use the data to understand what some of the underlying drivers or reasons for the trends might be. And I will come back in person again at the end to wrap things up. Thank you very much. So let me start with a screenshot from the Scottish Government website. This is a site that's updated every week, and the figure that I'm showing you here is called by the Scottish Government excess deaths. What they're trying to show you here in this graph is effectively the net effect of COVID on mortality beyond what you might regard as typical. So we have data here that goes all the way back to March 2020, which was the start of the pandemic in Scotland, through to the present. This video is being recorded in mid-October 2021. The top curve here, each dot represents the number of registered deaths in Scotland that week. So each dot represents deaths within 1 week, and with each successive week, a new dot is added. The light grey dots here are the deaths that were registered in a given week, averaged over the years 2015 to 2019. So for example, if I take, say, a week here, let's say week 10 of 2021, if you look at week 10 in 2015, 2016, through to 2019, look at the deaths that were registered in week 10 in each of those years and average them. That average value is this value here. And then in week 10 of 2021, this was the number of deaths that were registered in week 10, and that represents that dot there. So I think you can understand what these curves are then representing. Essentially weekly deaths in 2021 on the right hand side of this curve here, and the grey curve here, the average over 2015 through 2019, a 5-year average. That kind of represents some kind of baseline. And then the curve at the bottom here are deaths where COVID-19 is mentioned on the death certificate. So it might be that COVID-19 was believed to cause the death, or the death occurred where the patient was suffering from COVID-19. Now, the trend that I'll be talking about is in this data, but it's a little bit hidden. And I'm going to clarify that for you greatly by replotting this data in a helpful way. But you can see here in spring, summer and early autumn of 2021, there seemed to be a significantly greater number of deaths in 2021 compared to the 5-year average. Whenever these deaths in the sort of current time are greater than the 5-year average, the Scottish Government calls them excess deaths. I don't care for that term personally. I think it might be a little bit misleading. It's become synonymous with COVID deaths, but it shouldn't be, because there's a lot more going on than just COVID. So you see here, though, that there is a significant difference between the 2021 curve in that period I mentioned, spring, summer, early autumn, compared to the 5-year average. And yet at that time, COVID deaths were, I would say, modest, low or modest. So what I'm going to show you in the next slide is this very, very same data replotted for clarity. So here I've extracted the data from the Scottish Government spreadsheets, and I've replotted it in a much clearer way. So this purple curve here are the weekly deaths in 2021. I'm only going to focus on 2021 in this entire presentation. And the light blue curve here are the 5-year averaged weekly deaths, as I described before. Here you can see this difference would be called excess deaths. That would be primarily COVID, because you can see down here the red dots are the COVID deaths, and you see they're quite high in this period, which would be essentially an explanation for this difference here. But again, my focus is going to be on this period where we see a divergence between these two curves, and yet COVID deaths are actually quite low here. So that's the aim, but this graph is not a very useful way to understand what's going on. In science, often it's very important to plot data in a way that clarifies, that brings out the story that the data wants to tell. And an easy way for us to do that is, instead of plotting separately the weekly deaths in 2021 and the 5-year average, let's just plot one curve, namely the difference between the two. So on the next slide, what I've done here is plotted the difference between the weekly deaths in 2021 compared to the 5-year average pre-COVID 2015 to 2019. Now, when this difference is positive, the Scottish Government refers to this as excess deaths. The reason I don't like the term excess deaths is that I think that really what we're talking about is a difference in deaths in a given year compared to some kind of baseline. And that difference can be positive or negative, as we see here. Whereas the word excess, of course, pretty much always means more than. So let's just call it the difference in deaths between 2021 and the 5-year average, and that difference may be positive or negative. This positive bulge here is essentially COVID-19. That was the tail end of the big second wave that swept through Scotland at the end of 2020 and the beginning of 2021. But since then, thankfully, COVID deaths have become much smaller, due mainly to the vaccine protecting vulnerable groups. So then the question is, well, what is going on with this curve here, where we see, in Scottish Government language, excess deaths extending all the way back from essentially April through to the present time? Now, there will be COVID deaths hidden in there, and so we have two steps of clarification to understand this data. The first step is the one that we've already done, where we have plotted the difference in weekly deaths in 2021 compared to the 5-year average. And now the second step, we're going to subtract from this curve explicitly the COVID deaths. And let us do that, and we then get this curve. And this curve now, I think, is trying to tell us a story. So these are non-COVID deaths in Scotland in 2021 for each week relative to the 5-year average. And of course, in this 5-year average, this is pre-COVID. So we're essentially comparing like to like here. All that's missing are COVID deaths. We're not including them in this plot. And I think you'll agree with me that what is very striking about this plot is that there is a very clear trend. It looks like essentially a straight line going from the lower left to the upper right. This is what I'll be talking about for the rest of the video and what is concerning me. Now you might ask, why are the numbers below zero here? Why was the early part of 2021 better than the 5-year average in terms of non-COVID deaths? And I think the reason for that is very simple and expected, in fact, which is the following. In 2020, a very large number of people died of COVID. These were people mainly from vulnerable groups like the elderly and people with severe comorbidities, which would have affected their ability to fight COVID as an infection. I think there were roughly 6,000 to 7,000 COVID deaths in Scotland in 2020. Now, sadly, because those people that died were mainly in vulnerable groups, their life expectancy would not have been very long in any case. Typically, I'm not speaking about any individual cases here, but just on average, life expectancy in those vulnerable groups would not have been very long. And so they would have been contributing as a group to mortality figures in subsequent years to 2020. Because they sadly died of COVID in 2020, that means that for a number of years following 2020, we would expect a deficit in weekly mortality because of the death toll in 2020 from COVID. So this actually is entirely what we expect. We expect to see fewer than typical deaths, which are non-COVID. What we would expect is that this negative value would continue all through the year and actually for perhaps a number of years to come. What has been unsettling me and forcing me to track this data all through the year and now finally to make this video is the fact that these numbers have gone from negative to positive. And in fact, quite worryingly, for the last 20 weeks, they have been greater than zero. That means that despite the fact that a large number of people from vulnerable groups died last year of COVID, and despite the fact that we are subtracting out explicitly COVID deaths, still, even so, weekly non-COVID deaths in 2021 from week 20 up to week 40 are greater than the baseline, greater than the 5-year average. That's a concern. Furthermore, what we can do is a little bit of statistics here. We can fit a straight line to this data. And when we do that, this gives us a measure of how good a correlation is it really that this data is increasing over time. And for those people who know some statistics, you'll be able to appreciate that this so-called correlation coefficient is actually very high, and this so-called p-value, which is a measure of statistical significance, being so incredibly tiny means that this is an extremely statistically significant correlation. This data would almost certainly not have arisen by chance. So it is a fact that there is a real and strong positive correlation in non-COVID deaths in Scotland compared to a baseline of this 5-year average. So now that I've shown you the data and taken you through the clarifying steps which reveal the trends, let me now summarize the facts we have learned so far. So these are the facts that we have established so far using data from the Scottish Government. Firstly, the weekly counts of non-COVID deaths in Scotland have been steadily increasing throughout 2021. They have exceeded the 5-year average for each of the past 20 weeks, and the trend is highly statistically significant. So those are facts. And for the rest of this video, I want to now take on these facts and use a combination of data analysis and some hypothesis forming to try to get at what are the possible reasons underlying this trend, a trend that I believe is important, troubling, something that we need to understand as quickly as possible. So here I've listed 5 possible reasons. There will be others, but these are 5 that have occurred to me and which I think are important to at least list. So the first is, yes, there is a trend, but it's typical statistical or seasonal or annual fluctuations. It's actually nothing special. Second possible reason is that what we're seeing here, quite worryingly, are downstream health consequences of the lockdowns. This is something that has worried many people throughout the pandemic, that because there has been such restricted access to what we might call business as usual healthcare, like GP visits, scans, that kind of thing, there will be an accumulation of undiagnosed serious illness. That undiagnosed serious illness will, of course, be very serious indeed for the individuals concerned, and sadly will lead to an increase in mortality figures. So maybe we are seeing downstream health consequences already in summer and autumn of 2021 of the lockdowns of the year before. Possible reason number 3 are perhaps these deaths due to COVID, but COVID simply wasn't diagnosed. I think that is a possibility we should not discount. Or perhaps a little more likely, are these additional deaths due to essentially damage left behind after COVID has infected an individual? So a person may have had COVID, recovered from it, but the infectious disease may have ravaged their body, affected their immune system, created tissue damage, which then pushed them into other serious illness and very sadly death. That's also a possibility. Now the fourth possible reason here is one that I thought very hard about including because I think it can look very scary. However, I think that we have to be courageous and list it here. Are we looking at downstream health consequences of mass vaccination? We should all hope and pray that this is absolutely not the case, given that the vast majority of people in Scotland have received the vaccine. The vaccine has been an essential tool to protect the vulnerable groups from the ravages of COVID and has been a blessing in that regard. It is a fact, though, that the vaccine development is relatively rapid, and if there are subtle, and I mean subtle in the sense of affecting particular subgroups, if there are downstream health consequences that affect certain subgroups over a time period of 1 or more years, we simply would not know about those yet, given that the vaccine is so new. So even though the safety trials were conducted for short and intermediate term safety, we simply cannot know if there are longer term health consequences. So we mustn't ignore the possibility that what we're seeing is due in part to this particular possible reason. As I say, I hesitated to include it, and I think we should all hope and pray that is absolutely not the case. And then the fifth possible reason I've listed here is that there could be something going on that has nothing to do with COVID whatsoever. And we should not ignore that possibility. It's very easy to be distracted by the sort of elephant in the room, but maybe there are other things going on, so we need to keep that in mind as well. So what I'm going to do now is turn to some slides that can help us understand whether we can eliminate any of these possible reasons based on some further data analysis. In this second part of the video, I want to use additional data to try to identify which of these possible causes may be the most important in driving the trend that we have seen. So let us start with the sort of null hypothesis that it's really just typical seasonal or annual fluctuations. So in the next few slides, I'm just going to show you some more detailed data from the Scottish Government website to answer this question: are we just seeing a typical type of annual fluctuation in deaths? And we can do this by looking at the weekly deaths in those 5 years that constitute the 5-year average. So we can look at deaths, for example, here in this top curve, weekly deaths in 2015, which are the purple circles here, compared to the 5-year average, 2015 through to 2019. And interestingly, there is a trend there. I've fitted a straight line through it. It's a very weak trend compared to what we saw in 2021, but there is clearly a trend there from deaths being slightly higher than average in the first part of 2015 and then slightly lower than average in the latter half of 2015. That's interesting. 2016, we see another very mild trend, this time very slightly increasing. And then we can do the same for the other 3 years, 2017 and 2018. So in 2017, we see a very modest upward trend. In 2018, after quite a tumultuous start to the year, which I think was actually a very severe flu outbreak, but we see again a mild downward trend. And finally, 2019, we see a mild upward trend. So interestingly, yes, there are these type of sort of annual fluctuations where you'll have either a mild decrease or a mild increase in deaths throughout a year compared to a baseline. And I should stress that we're looking at deaths here relative to the 5-year average baseline. Now, we want to compare these types of trends to the one that we saw for 2021. So this is obviously a hideous picture, but let me just put all of those 5 years on one slide just to give a sense of the scale of the trends, which are given by the straight lines on this picture. And what we can do is superimpose the 2021 data on top of this to get a sense of, well, how great is the difference? So here with the bold red dots are the 2021 data, and remember these are non-COVID deaths in Scotland each week in 2021 relative to the 5-year average. And what you can see is that the magnitude of the correlation is far greater. The 2021 data goes from the bottom left of this figure heading up to the top right, whereas for all of the other years you can see from their straight line fits that they're quite nestled around the baseline of 0 here. We can be a bit more precise about this. We can measure the slopes or the gradients of these straight line fits, and you see from 2015 through to 2019 the slopes of these fits lie between 1 and 3, positive or negative, depending if the curve's going up or down. Whereas when we measure the slope of the 2021 curve, it's close to 10, effectively about 3 times larger than the largest slopes of the 5-year period. So what we can say quite conclusively from this is, yes, there are, interestingly, these, let's say, quite modest trends in each year of mortality data. However, 2021 has a trend that is at least 3 times greater than those typical trends, and is therefore in no way a typical year, and just calling this sort of seasonal or annual fluctuations is not going to be a good explanation for what we're seeing. So I think that analysis is pretty conclusive that 2021 is not a typical year, even discounting the COVID deaths. This trend is unlike something that has been seen in the past 5 years. So, to drill down further into those other possible causes, what we can do is look at cause of death. Now, the Scottish Government provides data in 5 broad categories of cause of death. These are cancer, secondly, dementia and or Alzheimer's, thirdly, circulatory, which would be heart disease and stroke, fourthly, respiratory, so various lung diseases, and lastly, a broad category labelled other, which of course is none of the other 4. If we look at the same analysis for each of those categories of causes of death, then if we're fortunate, we'll find that perhaps only 1 or 2 of those will show this upward trend. If that is the case, then we will have identified a very helpful sort of smoking gun that can help us understand the data. So let's have a look at that analysis right now. In this slide, I'm breaking down the 2021 weekly mortality data into these 5 groups that the Scottish Government has defined for causes of death. And I should stress here, there is a 6th category, which is COVID, and we are not looking at COVID deaths in this trend. So it's non-COVID deaths. And there are 5 categories: cancer, dementia, Alzheimer's, circulatory, which is heart disease and stroke, respiratory, and then all other causes of death. Now, what I'm doing in these plots is plotting the 2021 weekly deaths against the 5-year average for that cause of death. So, for example, in the top left plot here for cancer, we're looking at weekly deaths from cancer in 2021 relative to that number of deaths from cancer as a 5-year average from 2015 to 2019. Now, as I said just a few moments ago, the hope would be in doing these plots that we would see that actually only 1 or 2 of these causes of death would have an upward trend, and that then would essentially be a smoking gun of what's causing the upward trend in the mortality data. I think you can see here quite convincingly that in fact all 5 categories of causes of death have clear upward trends, and a statistical analysis shows that all of them have quite low p-values. So these are all strongly statistically significant with strong positive correlations of an upward trend. This was quite unexpected to me. I thought this data would really separate wheat from chaff, as it were, in terms of causation, but in fact what it's really telling us is that there's something quite generic going on, given that we see the same trend in all causes of death, even other, which would be quite a miscellany of causes of death. What we can do to help us a little bit in using this data is ask, well, how strong are the correlations? And what I've done here in the lower right is just show you the gradients of the best fit lines, which are an indication of how strong is that correlation. And I think you can see by eye that the respiratory deaths have a very strong positive correlation there. Indeed, the gradient of that line is the highest. I should point out the y-axis scales are different on each of these graphs, so you can't read these numbers off by eye, but these are the measured values. Very interestingly, cancer shows the weakest, smallest positive correlation. Now, I thought cancer was going to be quite a strong indicator, because the original motivation I had for this analysis was asking about post-lockdown negative health consequences, and something very close to my heart is early screening for cancer and cancer prevention. And I was very concerned, as were many others, that we may see rising numbers of cancer deaths that may have otherwise been preventable if it were not for lockdown. Now, this data shows that in 2021, there has been a slight increase in cancer deaths relative to the baseline over 2021, but it's a very modest increase. Now, I think, sadly, I do think we are going to see rising numbers of cancer deaths just because of the difficulties with screening and so forth. However, cancer is a slow disease. From diagnosis to death, it's very rare for that to be less than a year. It's usually many years. So of those patients that will actually finally die from cancer, of course, many recover, thankfully. So given cancer is a slow disease, it perhaps is not that surprising that it shows the weakest trend here. The other curves show stronger trends. I think the real standout, of course, is the respiratory cause of death, which has by far the greatest positive correlation. And actually, it was significantly below the baseline and has actually reached the baseline as of late summer, early autumn. Maybe it will, the data will bend here and just stay at the baseline, or maybe it will continue to increase. The correlation would indicate that it will continue to increase, but we hope not, of course. But I think the fact that the respiratory curve here has the strongest correlation is something that can be quite useful in aiding us to understand what might be causing this positive trend in deaths in 2021. Well, I don't know about you, but I found that particular data analysis quite surprising. I have to say, possibly quite troubling too. Let me now summarize based on what we've learned so far. And we've now come to the final slide of this video. And here I just want to summarize the second part of the video where we've been using data to try to get a handle on what might be causing the upward trend in non-COVID deaths. So as I said at the end of the first half of the video, it is a fact that weekly counts of non-COVID deaths in Scotland have been steadily increasing throughout 2021. What we've learned from the previous slide is that this is also true for all 5 categories of causes of death which are non-COVID deaths. That came as quite a surprise to me, I must say. How can we use the information that we've gathered in the second part of this video to maybe trim down this list of possible reasons? Well, I think the analysis I showed you a few slides back about the sort of seasonal fluctuations shows that 2021 is by no means a typical year. So I think we can discount the fact that we're just looking at seasonal fluctuations. I think there is a cause of this, which we, I think, need to understand and probably need to act against. So the second on the list, downstream health consequences of lockdowns. Well, as I probably said, it's unlikely that only one of these possible reasons will be driving the trend. It's more likely that there'll be 2 or more of them in combination. There's little question really that there will have been downstream health consequences of lockdown. No one really knows, I think, how severe they're going to be. I think the fact that we see for all 5 categories of causes of death an increasing trend over 2021, which again, is really quite concerning. I think that does indicate through its generic nature that we may see this reason number 2, health consequences of lockdowns, being part of the reason for that. And that would be a real wake-up call for us all, that we really must get on top of this as soon as possible. Clear all waiting lists for people that are waiting for screening or for diagnoses, and so on and so forth, would seem to be an urgent requirement. Possible reason number 3 about undiagnosed COVID. I think we can discount undiagnosed COVID, at least, probably discount this, only because we see the same trend in all 5 categories of non-COVID death, and I don't think that we would see that if we were looking just at undiagnosed COVID. So I think that can be put to one side. However, who knows what the long-term health effects of long COVID are if it's very severe, and that may be systemic throughout the body and may thereby lead to, in the worst outcomes, contributions to all 5 categories of causes of death. So I think this is very much on the table still. The 4th reason, which, as I said, I was questioning whether I should even include, but I think I must include it from a stance of honesty, and I think we have to be courageous in just looking this in the eye. We hope and pray that there are no downstream health consequences of mass vaccination for COVID. If the vaccination does have health consequences for certain subpopulations longer term, then those, who knows what those are, and these may be contributing to what we are seeing here in these different categories of causes of death. But I have nothing to offer on that at all. Now, I've sort of half blotted out this 5th possible reason about it being non-COVID related, and I guess part of the reason for that is that the strongest trend that we did see was in the respiratory illnesses, and because COVID is by its nature respiratory, I do think that probably what we're seeing here in 2021 is in some sense related to COVID, whether it's the disease itself in terms of long COVID or whether it is our response to the disease itself. So I'm a little doubtful whether we're seeing this strong trend arising from some completely non-COVID related cause, but I'm only half sort of scratching it out here because, of course, we don't know and it must remain on the table. So in terms of myself as a scientist and a member of the public who's doing this analysis through my company, there's not much more I can do myself. I think the preliminary analysis of government data is something that really any scientist could do. I have done it here and related the results to you. What we need now are experts in government or in the health services, medical informatics type people who can do what's called a multifactorial analysis of the underlying data, where they can really tease out what are the drivers. To do that, we would need to look not just at causes of death, but age distributions. So how old are people dying in these different groups of causes in 2021 compared to the 5-year average? Is there a clear male-female bias? Because we know COVID typically affects males more strongly than females. Are there deprivation indices relevant here? What are the socioeconomic statistics? And are these excess deaths related to comorbidities as COVID itself is? And by doing a multifactorial analysis involving these additional factors, which are not available to me as a citizen, but will be available to government officials in their data sets, hopefully we can get a much clearer idea of the drivers of this trend. But the thing I want to stress is that this is a live situation. I'm recording this video in week 40 of 2021. There will be new data appearing in a couple of days' time, and then a week after that, and a week after that, and a week after that. And if these trends continue to increase, this will become a major story in Scotland. I'm trying to give an early warning here, but we must take this very seriously, and the agencies need to do this analysis in order to understand what is causing this and to create mitigations to counteract this very concerning trend. And that brings us to the end of this video. Thank you very much for your time in watching it. I hope you found it interesting and helpful. This is a live situation. New data will be appearing each week. I will be tracking the data very carefully, and I plan to make a follow-up video in a few weeks' time to provide any updates. So with that, thank you again, and I will see you next time.